In fact, in the Brazilian Lymphoma Conference, I had the opportunity to talk about the CAR T cell for large B-cell lymphomas and mantle cell lymphomas. So there are two groups of patients with some kind of disease, and you have very important issues for patients that is relapsed or refractory to the standard treatments that you have, standard of care treatments that you have nowadays. So I had the opportunity to talk and to discuss with other experts in this section the development of CAR T therapy and how the CAR T today is used for these both diseases. I guess this is a very important scenario because large B-cell lymphoma has recently received new data regarding the autologous transplantations versus CAR T cell therapy. The Transform and Zuma-7 study brought to us new data showing that CAR T would be superior in follow-ups and results when compared to standard of care rescue and autologous transplantations for RR patients. So we had the opportunity to discuss this data and also to talk a little bit how you should select or better select patients to receive CAR T therapy. Not only all the patients would be fit or would benefit receiving this treatment, you have to consider the disease in progress. You have to consider other biological markers as the DHL and other variables that could implicate it in the inferior results to CAR T cells. So basically discuss the best patient to receive CAR T and the last data published. In the case of the mantle cell lymphoma, we have talked about where the CAR T could be inserted in the line to treat these patients. So first treatment, and then you have the BTK inhibitors, and the third line therapy, you can use CAR T for mantle cell lymphoma. Basically, you have the Zuma-2 data to discuss, and the point of my lecture, my talk, and that what we discussed with the experts was this scenario for mantle cell lymphoma and large B-cell lymphoma. Basically, select better the patients and always compared with standard of care. You have the opportunity to see, I guess, the CAR T in second lines for mantle and second lines for large B-cell lymphoma in the near future. So basically, this was my talk on the Brazilian Lymphoma Conference.